and we'll just move forward. And if you guys have any questions or anything like that, just chime in. It's what Tiffany gave us as instructions.
Yep, please do. Feel free. Did you guys want to record this, or are we good to go?
We are
Yes,
recording.
we are recording.
Great. All right. So thanks for joining us today for pandemic fatigue, the what, the why, and the how. The title is actually too long to fit on the first slide, so forgive me for that one. So what we want to learn today is what is it, why we want to actually recognize it, and how to prevent or address pandemic fatigue. And I'm not a major slide reader, so if I need to go more slowly or if I need to read more, if anyone is sight impaired, or if you have visual challenges that mean that I need to read more out loud, please let me know. I am happy to do that, and or to speak slower. I have a tendency to work with teenagers and children, and so I tend to speak pretty quickly because their attention spans demand that. So it's a rare treat to work with and talk to adults today. So I'm Tiffany Pittman. I am the school mental health coordinator for the Marshall University School Health Technical Assistance Center. I've worked in school mental health and substance use disorder treatment fields for a couple of decades now. I won't go into specifics, I'm old enough. And I want to give Stephanie Montgomery special thanks for helping get me some resources and some information on this presentation today, because I was actually on vacation last week while I was working on it. So a little bit about the Marshall University School Health Technical Assistance Center. I jokingly call it my division because technically I'm the only employee today for the school mental health portion of the team. And you all are familiar with Sheila and Regina and our other teams. We also have oral health, and we work with school-based health centers and folks like that. My main project is expanded school mental health, which will go statewide here in West Virginia, according to Department of Justice agreement by the end of this year. I do not think we are on track for that, or end of next year. And I do not think we're on par for that because COVID has slowed us down, but it will be expanding and going everywhere. So hopefully I'll see you in your communities for other initiatives soon. Up and down the Eastern Seaboard, we hope you've heard of us, or eventually will. All right, so today, pandemic fatigue. Are you tired? Are you sick of it? Are you ready for it to be over? Because I think these are the comments I hear most often as COVID-19 goes on and the guidelines are just never ending. It can feel like this challenge is just overwhelming at times. And honestly, I think folks are tired. I've heard people say, I was in a meeting this morning and they said, can somebody please turn on their camera? I just need to see a face today. And so I get that. And I think the last thing people want to do when they're in their homes with their children running around and, you know, dogs barking, things like that, is turn on their camera and unmute. But I think that that's a common perception these days, is that you sort of feel alone. And you're not alone. A lot of folks are feeling this way, and the economic and social sacrifices are becoming quite large. So if you are experiencing any of these things, you may also be experiencing pandemic fatigue. Now, what is pandemic fatigue? Let me tell you what, when I started doing some research on the definitions, I don't know how many definitions you want to read. So I posted a few on the screen, a few of the definitions that we found, but really the word fatigue it's not a clinical or diagnostic word at all. It's an everyday language word that refers to exhaustion, tiredness, and a feeling of just being worn out. So in this sense, we're not talking, pandemic fatigue is not necessarily a clinical or diagnostic piece. And we do use it a lot in the clinical therapy field that I work in, but it doesn't mean anything clinical. Just means that you're tired of the restrictions, you're tired of the pandemic, and to be honest, things are getting you down a bit. I think exhaustion and tiredness are really the most overwhelming piece, and loneliness for some folks. All right, so it's a nice segue into feelings. So here are some of the feelings that people are reporting largely, and this was taken from a variety of sources. We have all of our sources at the end, so feel free to look at those, and we can provide those if you like at the end of the presentation. But I notice that I have some family members in the frustrated and irritable section of this slide, and we call it testy when we're trying to be nice. And also, we're seeing an increase in um, psychosomatic reports from children and adolescents. So, tummy sickness, things like that, things that you would associate with anxiety, are actually showing up these days a little more often. And in adults, I think what's on the screen is pretty much what we're seeing. If anybody has anything different, let me know. And Regina, we call it attitude. I like that. So, physically, what are some of the symptoms that are kind of trending or at the top of the list for what we're seeing these days? And we are not speaking in clinical mental health terms. We're not talking about folks who are hospitalized or long-term issues. We're talking the general population here. This is us. We eat more or less than usual. How many have heard of the COVID-15 or the COVID-20? Let's not make it higher than that. but I have some friends who are like, oh my gosh, if we don't get out of this soon, I'm gonna need more clothes than I've already bought. Um, Sleeping or staying in bed more or less than usual, lack of motivation, trouble focusing for those who aren't already attention deficit, like myself. And Regina, snippy, snappy, and snarky, the three S's. I like attitude there. So edgy or nervous, argumentative, racing thoughts, and withdrawal. So I like what Elaine said earlier, that even though you don't get to physically be with someone, you can get together by Zoom. But some folks are withdrawing. We have lost in one county, we have lost a lot of children that are no longer connecting. Their parents, we've lost them. They're no longer connecting for anything. And so it's kind of a scary time. All right. Why is pandemic fatigue serious? Let's think about that. If we don't battle pandemic fatigue and we lose our motivation to maintain COVID safe practices, have you seen this? I know that if I'm sitting in my car and I'm looking around and I notice the amount of people going in and out of stores with no masks, and it's not that the signs aren't on the door. It's not that there's not someone at the door of the store. They just look at them and keep going in. And I'm thinking, oh my gosh. And the store folks are not going to say, not going to stop you, because we've actually seen violent responses. And so no one's going to take that step to try to force someone to do something. But um, over time, I think the numbers of folks who are tired of it and who become complacent, and even though the numbers are going up and up, the counties are getting redder, orange, whatever the colors are, even though the numbers continue to go up for death rate, less folks are actually wearing masks and less folks are practicing safe distancing. So that is, I would say I would attribute part of that to pandemic fatigue. And that does put folks at greater risk. And unfortunately, that sometimes translates itself to folks who really aren't the ones going out in public wearing the mask. It's folks bringing it home to their loved ones who are, physically not able to fight off the virus. So if we think about this, without sustained behavioral pattern change, relapse to prior behaviors typically occurs within 6 months. That's a truth. Think about diet and exercise. Okay. How many folks say they go on a diet and within 3 to 6 months, they're okay, that's enough. I can't do low carb or something like that. This is no different than any other behavioral change that we've seen. So the emotional cost is something that folks don't talk a lot about. I recently saw this. We had, actually a family member, and they're young, 20 something, kids were going to the beach and they weren't masking up and they weren't wearing that. Well, now one of the parents is in the hospital and he's very ill. And so the children and the grandchildren are they're feeling very much guilty and sad, and they're afraid that they're going to lose him because of their behavior. And they thought it was a hoax, and they found out that it wasn't. And so I think that not only is the emotional cost about, the isolation but also those who are living, or why did they get it and I didn't? Why did they live and I didn't? You know, things like that. So we are seeing an upsurge in anxiety and depression. And now couple that with the holidays, and now you've got a lot more folks out there who need some expert help. So what can you do to beat pandemic fatigue? We've talked about all of the depressing pieces. Let's talk about something fun. Okay. So make sure to pay attention to your physical and emotional needs. Eating a nutritional and balanced diet at regular meal times is important, and that's for everyone. What I actually kind of enjoy doing, and what I've noticed that a few of the teams that we have doing, is they'll do a video chat when preparing meals with a family or friend, and they'll prepare meals together, and then they sit and eat or chat by cell phone, or they do video phone. We've had some school counselors and teachers actually do cookie baking with students and their families, and so they'll be, hey, what color sprinkles should I put on the cookie? You know, that sort of thing. And then at the end of that, they have folks who are actually delivering small packages of cookies to the families that participated in the video chats. And, you know, they socially distance, but it's a lot of fun. And Sheila said, yeah, you and your grands do that. Yeah. So it's a good way to stay connected. And have a little fun and do something. Sometimes, especially if you're working with teenagers, you know, they don't want you to sit there and stare at them, or other adults. You know, who wants to be stared at for an hour at a time? But if you can do something together online, there are lots of fun things you can do online together. So we'll get to more of those here in a second. So sleeping at regular times, your normal sleep range. And I put 7 to 8 hours because that's sort of a national average, but to be honest, folks vary widely. So that one's hard to judge for anyone other than yourself or your children or family members. And exercise. It's a big deal. Can you get outside, socially distant, and actually still do things? Can you play bocce ball, or can you take a walk? Elaine and Stephanie, could you all walk in your community together on Zoom and say, hey, I'm beating you. You know, I've got a mile in. How many do you have? You know, things like that. Just stuff to make it more fun. And if you have folks that are in your, what we want to call it the core, your core circle that you live in the same house with, then clearly you all can work together too. And I don't know how many people have Wii's or other, I don't know what they call them, Connects. Sorry, I'm not that young to figure all that out, but I know that we have families who are bowling together on some of these video games, and they're doing things like that. And so I recommend that. I think it's fun. I have a 20-some-year-old young man as a son, and we actually get together on a gaming platform called, it's called Discord. It's actually a chat platform, but it's what all the gamers use. And that's where he is. So I made an account and I talked to him on there, and I created a video game account so that I could actually play with my son online. I'm horrible at it and he tolerates me, but we actually get to be together for a while. And sometimes that's what matters. So if you have high levels of excitement or anxiety, and I've used the word excitement here, that can mean just an elevated emotional response. That doesn't necessarily mean panic or extreme joy. So those are a little different. So if you have high levels of excitement, you can use breathing techniques and calming techniques. You can use mindfulness techniques to help you through those really rough times, calling a friend, something of that nature. It is that one bullet point. People are going to debate that, and that's okay. But when I talk about being physically impossible to maintain a high level of fear or excitement for an extended amount of time, I'm talking panic and extreme joy. So if you have family members or you yourself have panic attacks, then sometimes what you need is that immediate technique to help you just get through those moments, help you get through that 15 minutes or 10 minutes of panic, so that you can come back to your thoughts, because your emotional response is always elevated above rational thought in that time. And so that doesn't help to say that if you're in the middle of a panic attack, but maybe it does. Maybe if you're giving yourself self-talk, or you can use your breathing techniques, and that will help get through that. So any questions or ideas on that? Feel free to put those in chat. Let's see. What else can you do? Okay, limit your news intakes, folks. Seriously. Uh, yeah, if I watch the news, it honestly, I feel that it's all about eliciting an emotional response. And if you look at the research, I'm a big research person. I'm kind of a nerd that way, and I don't mind. I'll proudly wear that. But I love research, and I love looking at what creates an emotional response, what elicits emotional response. And I will tell you that folks who are selling you things and folks who are putting your news out there, they also know what elicits an emotional response, and they use it. It's how they sell papers. It's how they get views. But your body and your mind can only take so much of that in a day. It will wear you down, or kind of can elicit a numb feeling where it's like, oh, look, the 56th, tragic death or shooting or something of that nature today. I can't take anymore. And for teenagers and children, it's important not to have repeated exposure to violent events like that, because it can really drain energy, and it can also make something like that seem like a normal everyday occurrence, when we don't want folks like Dimitri to think that murdering someone is an everyday occurrence. So limiting news intake and increasing your uplifting and fun intake, doing something silly is, or even just relaxing, is much more beneficial. So I actually just have to turn off the news and say, okay, I've had my 30 minutes. I know what the headlines are. I'm done for today. During the election, there was a lot of therapy advice given out on that front too, as far as, hey, why don't you turn that off for a little while and let's do something fun? That would make more sense. So for stress reduction, I'd love to know what some of you do for stress reduction. Mindfulness is a big thing. Meditation, yoga. I don't know if anyone's seen those ASMR videos where it's literally just noise, like a coffee shop or a fire in the background. They put some pretty, or snow falling, something like that, and just literally just everyday sounds that are in the background that kind of tend to relax you. You can go a step further and do progressive relaxation, reading. I love coffee clutches via video chat, just chatting with I call it chatting with the girls, but you can do that with the guys as well. So sewing is a good one. I have a friend who just finished a quilt. It's beautiful. And that, I believe, is her. It's much cheaper than therapy. Kickbox. Love it. That is great. Physical exercise. Yes. Physical distance does not necessitate social isolation. So I love exercise as far as getting out there. It actually decreases it decreases a lot of the negative, I guess, intake that you get. Walking across America. Stephanie's already to, did you say Minnesota? Missouri? So phone calls, video calls. Ooh, classical stretches. Great. Do you use that with yoga as well? The stretching? Blue springs. Puzzles. Puzzles are good. How about writing letters, or volunteering to craft items for seniors, or volunteering to craft items for homeless shelters or animal rescues? Some folks use online spiritual and religious services, taking a class online. Folks who are learning pottery or taking up. One lady was talking to me about how to infuse herbs. It was way above my head, but she made some amazing products, and she's making a little, what she calls side hustle money on that too. So good for her. Selling on eBay for one lady. I was pretty impressed. So, okay, I'll check that one out. So not yoga, but it's classical stretches. I'm gonna look that up. So, and the whole piece of this is that perception matters, and an external focus is what is important. If you're looking inside and constantly looking inside yourself, criticizing, seeing what's wrong, or seeing how you feel, and it's a negative feeling, looking outside yourself and trying to focus will improve. It will improve your mood, I would say, unless you're working with something that's clinically diagnosable, and then that's a whole other ballpark. Not going there today until the end of the presentation, but if we're talking about you feels natural, what you feel is valid, and you have a right to your emotions. I know people, oh, you shouldn't feel this way. If you hear folks saying you shouldn't, you ought, you must, then that means someone is, and they use that in a belief sentence, that means they're imposing their beliefs upon you. And you absolutely do not have to accept that. You have a right to your own emotions and your own feelings and what you feel is normal, natural, and valid. So I'll give you that. Um, so talking yourself up is actually important. Positive self-talk's a big deal because your perception is reality. It's what you think and what you feel that influences your day, and that's what matters. And so I will get off my soapbox. But all right, beating pandemic fatigue. It's important right now too. We have changing seasons. Folks are talking about mud and snow and mud and snow, and snow's great if you like it. And but folks, when we talk about that, I need natural light. I want sunshine. It could be 20 degrees, but I really want the sun to shine sometimes. And I still want to get outside and do activities just with the appropriate clothing. I want to maintain my routine. So maintaining your routine is a big deal too. If you're going to have your coffee clutch every Thursday at 5, then have your coffee clutch every Thursday at 5, even if you don't feel like it, because it will help bring your mood up. So creating new traditions. How many of you are doing that this year because you don't have a choice? Do you know? If you quilt or you sew, are you sewing with friends online? Are you having bridge parties? Are you staying active with the folks that you can stay active with, your friends that you talk to on a regular? Family members? Are you baking together, but maybe you can't do it in your kitchen, so you're doing an online baking stream or something of that nature? I saw a commercial about that, and I thought it's not a bad idea. We're already doing it. So if you talk about behavior change, folks, let's see, at this point, people are like, oh, people in general, the population in general does not like to change behavior. We don't like it. We don't like to be told what we can and can't do, when we can or can't do it. And we don't like things like that. So, but if you think about it, think about hand washing 50 to 100 years ago in the 1800s. Think about hand washing, something like that. Was it commonplace? Nope, but it is today, correct? So that's a positive habit. Think about stopping at traffic lights, wearing seatbelts, everyday precautions that we take that we did not take decades ago. So in this world and in this time, mask wearing, hand washing, and social distancing are basically new behaviors that we've had since March. So these are positive habits. To be honest, I love the social distance piece. 6 feet away from me is great. I don't have any problem in a public space. If I'm in a grocery store, I want you to be 6 feet away from me. COVID or no COVID. So it's a positive behavior change, but it takes place over time. The huggers, yeah. Seatbelts is a big deal. So huggers, yes, huggers are having a challenge right now. And so actually I have a student and they have this huge teddy bear and huge hug pillows. Have you seen the hug pillows? And it doesn't take the place of it, but I'll tell you what, a kitty or a puppy certainly can help a little bit. But yes. And you said work harder at thinking before you speak, right? That's actually a good point. I like that. So the perception piece, one thing I wanted to know is if in my head I'm constantly frustrated and I'm constantly thinking, oh, this is horrible, I just don't want to deal with this, I don't want to do this today, that sort of thing, then I have to do what I call a reframe in a therapy world. And I have to say, you know what? I am very lucky to have my parents. I'm lucky to have a son whom I adore, even if I can't see him personally, because he works at, Lowe's and is constantly getting quarantined because he's been exposed in the work environment. But I'm lucky to have these folks that I can contact with or connect with in video chat. And the sun is shining, the cat's behaving, the Christmas tree still standing, things like that. Whatever your positive outlook can be. So sometimes it's sort of what I would call sort of a mental reset, working hard at thinking more positively and also speaking more positively. If I'm in a meeting and folks are having a rough day, I want to be the positive one that comes in and says, you know what? I'm sorry that you've had a rough week, but we've made some really amazing strides in this part of our program today. And look at the work that you did on this project. Isn't it amazing? And so I would like to be that person, even if it's maybe not how I'm feeling inside, it's how I want to present outside, because I can be a positive influence in other folks' lives that way. So one thing I want to say, and this is sort of one of the closing slides, but if your symptoms persist for more than a few weeks, and I'm not talking pandemic fatigue, I'm talking clinical symptoms. If you find yourself depressed or anxious, please do contact your doctor or therapist. The biggest thing that I would say on this note is that telehealth does work. And sometimes it's actually more comfortable for folks. I use Zoom. They've used DoxyMe, and there are other secure telehealth platforms to see if there's actually an underlying medical cause for a mood issue, or if you truly do have a mood issue, or if you're just, to be honest, one of the many folks who are experiencing a normal reaction to a rather difficult situation that we've been in since March. It keeps going on and on and on. And so there can be physical issues that can contribute to this too. And, folks may attribute it to mood when in reality, it could be an underlying medical condition. So we're all in it together. Our job is to get through it together and support each other in the best way that we can. So resources and bibliography, there are 3 pages of these. I would invite comments and questions and anything of that nature at this time that you'd like. I know we're a little early, but
I have a question. Do you have any advice for people who maybe have lost a loved one and this is their first, Christmas or holiday without them? They're experiencing grief and in addition to pandemic fatigue?
Yes. So that's the case, unfortunately, a lot of the place. And I would say, first things first, honor your feelings. If you're feeling horrible, you feel horrible. If you're feeling sad, you feel sad. And pretending like it's all okay, you can do that to get through a day if you need to, but stuffing emotions is not going to be productive in the long run. Okay. So, and I don't mean go to the extreme and, I don't know how to say this in a nice way. I tend to be pretty blunt. I work with teenagers and children a lot and families. So one of the things that I look at though is experience your emotions and be true to them. What you feel may not be what the person next to you feels about the death of a loved one. Okay. So if you don't feel like putting up a Christmas tree and it's something that you normally do and it's important to you and your family, maybe you do want to go ahead and put up that Christmas tree this year, or maybe you want to skip it. I honor that. But the depression and seasonal affective disorder and all those things that go along with the grief reaction are 100% normal. So grief has its stages. You get angry, at denial. To be honest, I like to tell folks, honor it and walk through it. And it doesn't hurt to seek professional help for that, or at least a support group. There are support groups meeting virtually, and there are folks just like you who've lost loved ones. There are lots of them. So if you need help getting linked up with one of them, give us a yell. And also, Elaine, you're correct. Crying is cleansing. People say, oh, you're crying, you're this, you're that. So what? It's mine. I'm going to own it. If I feel like feeling like this today, then I'm going to do it. Now, I may reach out to my best friend or a family member or someone for some support and say, man, I'm having a really rough day. Can we just talk for a few minutes? That's fine. It's absolutely okay to do it. For seasonal affective disorder and the holidays and things like that, Regina, getting light may sound odd, but getting light and focusing on things that are outside of you can help. So making blankets for local homeless shelter or local animal shelter, things of that nature, setting a task or a focus, honoring the person that you cared about through a service activity can help. Also connection if you are religious or spiritual and you have a connection to that community, I would say make sure that you don't lose that during that time. Does that answer? It's a long answer, but.
Yeah, it does. Thank you.
So I did list on here the Cabell County Health Department. That doesn't help you all, but there are health departments all across the state and the nation, and they actually have services. I listed this one because it's my local one and it was just in my inbox, but there are many out there, all up and down the Eastern Seaboard and all across the United States, and also listed the National Suicide Prevention Hotline. That's a big deal. And also for teens. Stephanie, I wanted to let you know that West Virginia has a youth supported hotline now where teens and young adults and other youth are trained to speak with folks of their own ages to do that. And I believe that there may also be senior hotlines for that same thing for senior citizens. So I think that's actually important. Click to the next slide. Okay. There are some of these are articles that are tips, and I relied on Stephanie a lot for these. Thanks, Stephanie. We did have some questions on a other presentation on how does COVID affect those with chronic disease or with diabetes. I think another question I had was COPD. They want to know how it affects COVID with COPD, and honestly, I can't answer that question. It's kind of a new thing, but I would try to find an answer if anybody has those questions. More resources and articles on coping. I was interested to see the USA Today article. I typically don't post a lot of, just what we call popular news, but if they're positive articles on how to cope, I'm with that. And that's it, Stephanie. Good one. Generally, the audience for these, yep, that's great information. Yeah. So the audience for today, I think that's great information, Stephanie. I appreciate you providing that. So that's pretty much what I have for today. I don't know what I don't know. Please ask questions, make comments. Feel free to unmute and make comments if you want to. This is sort of like a fireside chat for me.
Thank you, Tiffany.
Yes, I enjoyed the presentation. Thank you so much, Tiffany.
Yeah, thank you for letting us hone in on your presentation. I enjoyed it as well. Very helpful.
Nice job, Tiffany. Thank you.
Yeah.
I agree too. I appreciate the opportunity to learn more.
Thanks, Cheryl. I'm definitely looking up classical stretching. I want to know, I want to know what that is now.
You can find it on YouTube. She has some classes there. Miranda Esmond White, might be White Esmond on the end, but it really does help a lot. Give you some energy without doing hard training and exercises.
That sounds good. I'm looking forward to looking into that. We're trying to find an evidence-based practice mindfulness program for West Virginia, and we have been struggling to do that. So I need to broaden my search a little bit to find that, because we definitely want to encourage it, but the federal government funds evidence-based, and so we understand that, and I can respect that, but maybe we just need to do more research because we know it works. It's just proving it.
Tiffany, can you explain what mindfulness is?
Yeah, so mindfulness in the setting that we're using, we have a couple of different entities within West Virginia that are trying to research whether or not it works. So it's everything from breathing techniques to yoga to stretching to body awareness. And that can be for adults and children both. So it's sort of, people kind of roll their eyes a little bit when you say breathing techniques, but it doesn't matter. You think about if you're breathing from up here, if someone walks in my office and their shoulders are up and they're breathing from up in their chest, I'm looking at them and I'm like, okay, so my first job is to help them relax, right? And I can do that by calmly speaking. I monitor my breathing and help them match it and things like that. And so teaching them literally how to lower their shoulders, to breathe. You can actually watch somebody tend to relax. And then so we take it a step further into stretching and sometimes even into yoga and things like that. But most of the time there's a lot of body awareness that goes along with it. Cause I can look at them and say, wow, you feeling pretty anxious today. Now, how do you know that? Well, let me tell you how. And so I do. And they say, oh, and I say, so if you take a deep breath and it's from down here, how does that feel? So anyway, we go into things like that. And so it's not always therapy in my office. Sometimes it's just working with folks or even coworkers who come in, we're talking on video and I can say, wow, you've had a long day. I can tell already. You don't even have to say 2 words. So let's just all take a deep breath and get a drink and be together for a little while. We're going to get through this together.
Tiffany, I just want to mention, just to validate what you're saying, because previously I used to work at Wake Med Hospital, and we learned mindfulness techniques. And it's the first time I found out that all this time that I thought I was doing a deep breathing, I was doing it wrong. So then I had to learn how to do it right. Mm-hmm. But we had a whole bound volume, which I still have copies of, about mindfulness, especially like you said, about eating. Mm-hmm. And it's surprising how many people don't know how to breathe and relax. Yep. And so I appreciate the reminder of that being mentioned in this course, because that really is so important, as well as with the exercising. So I have created what was called a quiet cube. And I took all the information from that mindfulness, information that we got. And so it was a place where we could go to this cube, you could color if that's what helped you relax. You could take your private call that you need to check on your mother or a maid or someone sick. And so when you went into this cube, everybody knew, well, it wasn't a cube, but what you call this, it was a cube at work that you work in cubes. So everybody knew when you were in that cube, that was your quiet time, that you were de-stressing mm-hmm. and able to then go back to work a little bit more relaxed. And yes. so it really, really helped a lot. And then we would start our meetings with some mindfulness or some stretching and exercises, things of that such. So it really, really is a very important thing to learn about mindfulness.
I'm glad to hear that. In schools, we call them the calming corners or coping corners. And then I've been encouraging schools across our state to implement spaces for teachers, because this is a person who touches how many students' lives. And you know what? We're all human. We work in schools. We're going to get frustrated, and not all of us work in schools. I mean, I work in a hospital setting similar in a medical center, but my job's to go to schools and counties and places like that. And so, do you have a place for your people to be well and healthy and to calm and just have a waterfall, or, have tea, just have something there for them, a place where they can calm and say, I need to tap out for 5 minutes so that I can be nice to these students when I go back in my office. And it's a big deal because everybody's feeling the stress right now. And, we are having face-to-face instruction in schools. Now, couple that with the high transmission rates, and it's really necessary to work with all populations. So, and breathing and wellness, we used something called Yeti bodies, and schools come up with really interesting things. But what I find is that when we do the calming and mindfulness techniques, it really actually helps the teachers a lot and the adults in the situation as well. And then they're better able to cope and handle it. So they may say it's for the children, but to be honest, actually it benefits all of us. So.
Tiffany, we've, with our general yoga program, that we've been doing for years and years and years across the Appalachian region, we've trained, there's been teachers, there's been domestic violence shelters, the staff there, so that they can, that's a form of, intervention, when there is a crisis. And then you've got staff and all of those folks, and if the staff is not happy and healthy and calm and relaxed when there's a crisis, no one's going to win here.
It's true.
So we've
I would-
promoted the program for a long time now. And in fact, what Regina posted on there will be our very first, we'll be starting in the first of the year and doing this virtually. And so it's going to be different than doing in person. You know, we've all been there so far, but yeah, so we'll be starting that the first of the year, doing this training virtually. So
I want to be there. Actually, I would love for you all to do a webinar for our state folks. We have a couple of hundred on a list that we tend to get pretty good turnout for some of those webinars. I'd love for that to happen because we really want to implement that. And sometimes there's not funding, but we have folks who are so passionate about it, they will do it anyway. And or we can incorporate it into another program as a part of that program. I think it's vital. Folks, you know, we have to learn how to breathe and interact with each other and stay positive and support each other because right now we're what we have. So
Yeah.
I value that.
Yeah.
All right. I think we're good if everybody's good. I really appreciate everyone showing up today. And I will toss this back to Sheila and Regina for a closeout if you're okay with that.
Sure.
Thank you so much. I enjoyed that a lot.
Thank you.
Good job, Tiffany.
It's all of us. Thank you.
Do you have
Tiffany,
any questions?
question?
Able to share your slides with us so that I can pass that along with the YouTube link.
Absolutely.
Okay, great.
Thank you. So we're going to end a little bit early today. We will post the recording on YouTube. Normally it's available in a day or two, and Sheila always sends out the link as soon as it's available. So if you want to share today's presentation via YouTube, you can absolutely do that. And we'll also share the PowerPoint after today's session. And we appreciate you so much for joining us for office hours. And we hope that you'll join us in January on the 4th Wednesday at the same time. It's 12 p.m. Eastern Standard Time. If you're on Central Standard Time, it's 11 a.m. And we thank you so much. And happy holidays, Merry Christmas, Happy Hanukkah, Happy Kwanzaa.
Happy New Year.
Happy New Year.
Same to you all.
Thank you.
Thank you.
Thank you. Merry
Take
Christmas.
care.
Merry Christmas.